Recording in progress.
Let's go ahead and call to order our District Board of Health meeting for Thursday, October 26, 2023. If we could have roll call.
Chair Dare.
I am here.
Vice Chair Reese is absent. Commissioner Garcia? Here. Dr. Danko is absent. Michael G. Brown?
Here.
Dr. Clacking?
Here.
Dr. Novak?
Here.
And I'm Susie Valdespin, your recording secretary. Chair, we have a quorum.
Thank you so much. If we could go ahead and stand for the Pledge of Allegiance. And Ms. Garcia, por favor.
Please join me in saluting our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we are moving on to item 3, approval of agenda. Do we have anybody like to anything out of order or have a question on it or on approval? I have a first.
Second.
I have a second. Any more conversation? All in favor?
Aye.
Aye. That passes unanimously. Please press your button and let the record show that Dr. Danko has arrived.
Yay.
So, very good. Let's go ahead and move on to 4 recognitions. And Health Officer Dick, I'm going to hand that over to you, sir.
Thank you, Mr. Chairman. I'd like to begin with years of service, and today we're recognizing Felisa Hilliard, who has 20 years of service at Washoe County and Health District. She's there in the back row. Congratulations, Felisa.
She's a hero. She does a lot of stuff.
Yes. Yes, and always gets the best deals for us for if there's food involved. So, several new hires in EHS, and I'd like to ask Mr. Fida if he could bring up Francesca Rubio, used to calling her Frenchie, and Sandra Puga, who I'm used to calling Sandy. It's a new office specialist in EHS.
Thank you. For the record, Robert Fida, EHS Director, and I'm kind of proud to introduce our newest hires. They're part of our admin team up front, and to my right, I have Frenchie, or Francesca Rubio. She comes from SoCal, was raised in Reno. She actually comes from us from Cognizant. She was a trainer for, I believe, Microsoft products, and she's also a folklorico dancer. So. And then to my immediate right is Sandy. She was born and raised in SoCal, been in Reno since 2008. She comes from us from the First Independent Bank. She was a personal banker there for 11 years, and now she's joining us, the HS team, as part of our admin team. So I would like to give them a round of applause for, and thank you for joining us.
Well, Sandy's been my personal banker for 11 years, and so there's a hole over there. So she's a great. I don't know you yet, Frenchie, sorry. But awesome hire.
All right. Next, I'd like to announce a couple of promotions. In EHS, we have Ian Check, who is here. Congratulations, Ian, on your promotion from EHS training to EHS specialist. And then also Erin Myers, I don't believe is here today, and she was promoted as well from EHS trainee to EHS specialist. So congratulations to both of them. And then a couple of transfers that I wanted to announce. One is Virginia McDonald. Virginia, if you could stand up, please. Thank you. We're very pleased to have Virginia McDonald transferring back to the Health District from the Public Guardian's Office. She's an office specialist also in EHS. And also, sadly, we have Sabrina Braswell, our EMS coordinator, has moved over to the county manager's office where she'll be part of the county emergency management team. So we haven't lost Sabrina completely. But she's moved over there to support that office.
Dave, you better treat her right or we're taking her back. I'm just calling it now.
Then we have a number of Washoe County Health Heroes. that I would like to recognize. We have Lori Griffey in Administrative Health Services. There's Lori. And Lori is recognized for adaptability, trustworthiness, and collaboration. So congratulations. We have Yara Diavola with my office, who is being recognized for inclusivity. And Yara's back there. Erin Dixon, also with Office of the District Health Officer, being recognized for collaboration. There's Erin. Julia Ratty with my office for inclusivity. And I see Julia
Good job.
back there. And next to her, Camarina Augusto, also. And then some honorable mention for our health heroes. We have the EHS admin team, Jack Santino, Steve Fisher, and Taylor Stokes. So congratulations to all of them.
I want to say just something real quick. I just want to say, one of the things I know some people might be like, man, they make a big deal about these. Is it really that big a deal? Please know it really is. We want to celebrate these moments because without them, imagine how this place would run if we weren't inclusive, if we weren't kind, if we weren't patient, if we weren't all those things. And so we don't just do this lightly, that we take a moment and pause our board meeting. So to me, I think they're very important. Matter of fact, I wish all my boards did this on all my things because it actually is something very important. So good job, heroes. Thank you.
Right. I also want to thank Dr. Danko, who joined us yesterday for a celebratory luncheon to recognize our health heroes. So I appreciated you doing that. We usually have a board member that participates to recognize staff. And I also wanted to recognize Dr. Danko, who was recognized as the Healthcare Hero Humanitarian Award for the year by the Nevada Business Magazine. So congratulations to you, Dr. Danko.
And I have a signed copy of the Hero Act. If anybody would like to bid on that, this is going for. Yeah, you didn't think I'd save that, did you? Congratulations.
And then I also have a proclamation. I think I'll run down to the front. Okay. I'd like for Andrea Esp to join me for this. And after that, we can do some pictures.
He came in just in time.
Thanks for joining us today. Okay. So we have also Chief Cindy Green and Lieutenant Stalkup with us today for the proclamation for Crash Responder Safety Week. Whereas law enforcement officers, firefighters, emergency medical personnel, road maintenance crews, public service utility workers, and tow operators place themselves in danger every time they work within inches of vehicles traveling at highway speeds to conduct valuable life-saving operations in adverse weather conditions. And whereas it is imperative that we promote safer incident scenes through public education and awareness to protect all responders as they courageously work to clear incidents. And whereas Crash Responder Safety Week serves as an opportunity for the Department of Public Safety, Nevada Highway Patrol Division, and the Nevada Department of Transportation and other first responder agencies to participate in coordinated efforts to educate the public and bring awareness to first responder safety, and to promote effective traffic incident management strategies and training for first responders. And whereas Northern Nevada Public Health reminds drivers of the Move Over law, which states, if possible, drive in a lane that is not adjacent to the lane where the traffic incident is located, unless roadway, traffic, weather, or other conditions make doing so unsafe or impossible. And whereas, according to the National Highway Traffic Safety Administration, less than 30% of Americans are aware of move-over laws and fail to abide by them. And whereas Nevada is committed to effective traffic incident response and management through collaboration and training, which reduces the duration and impacts of traffic incidents and improves the safety of motorists, crash victims, and emergency responders. And whereas over 1,500 first responders have participated in Nevada Traffic Incident Management Coalition efforts throughout the state since 2014, and 75% of all first responders in Nevada have received traffic incident management training. And whereas during Crash Responder Week, the state of Nevada remembers and honors those national first responders who lost their lives in 2022, 17 law enforcement, 11 fire EMS, 18 tow operators, 4 roadside technicians, 1 DOT SSP, for a total of 51 first responders. Proclaimed by the Northern Nevada Public Health District Board of Health that the week of November 13th through 17th, 2023 is Crash Responder Safety Week with the theme Protecting Those Who Protect You. Adopted this 26th day of October 2023, signed Chairman Christopher Dare, Washoe County District Board of Health. And Mr. Chairman, I will turn it over for some comments from these individuals, and I did not bring the signed certificate that's up there, so I'm going to come up and get that from you.
I'll sign it while they're chatting.
All right, thank you.
Please, come say something.
We're sorry for being tardy. We just had a model dairy truck stolen downtown and rolled over on 2nd Street, so we were in the middle of a crash right at this
You know what,
moment.
that's what all crash people say.
So that's why but we do appreciate it, and we do thank you for the block mission.
Gotcha. Would you like to share something? I'm good. You good? Well, I'll share something. I can't multitask, so I can't sign these till I'm talking, but I just want to say one of the things we're very aware of is these accidents continue to grow. They're not diminishing, and we know you guys are running towards to get helping these people, and definitely putting yourself in danger. And so thank you for doing this, and please continue to help keep our community safe. And however we can help, a proclamation doesn't really tell the whole story. So this is just our small way of saying thank you. But please know in the future, if there's anything we can do that's very practical, let us know.
Appreciate it.
Thank you. But don't go anywhere. We're going to take a picture once I sign these. Any other board members want to say anything? And then I'm looking for a motion.
Motion to accept proclamation as presented.
I do have a first. I have a second. All in favor?
Aye.
Aye. That passes unanimously. This is the proclamation. This one too? Okay, gotcha. And then you want that?
Picture time.
Everyone push their buttons? Very good. We're going to come down and take some pictures. Rick, I'm going to bring this. You get to come hold this.
Yep, it's gonna go to our law enforcement individuals, and then it's getting signed by MSAD next week.
And if we can have you guys come up in the well, we'll get some pictures taken.
See what she's doing?
You guys come on in. You're the center. You stretch out as
Great, thank you. So, as we were kind of heading this way, we were like, oh, we gotta go put this over there. Put this. But the driver got out and that was fine, and she's still, when we left, they were still trying to get her out. She was fine, she just didn't want to get out, couldn't get out. No.
She's a fabulous dancer.
Welcome back, I should say.
Good. Thank you.
And you gotta go get in the middle of Oh, we're in the health department.
Good. Thanks.
Karen, you want to come down and what's it?
All the health heroes, come on down. Get ready, come on, woo! Come on, come on.
A little faster.
I don't know why everyone's neglecting this side. You ready? 1, 2, 3. I'll take a few more. Okay.
Thank you, guys. We got our Rika.
Oh, yeah.
You gotta get in the middle of it. So I need one over here to make it even. Kevin, Kevin, come over here. Kevin, come over here.
There we go.
Man.
1, 2, 3.
Next year at the auction.
That's exactly. I'm not sure what was next, but we'll show up somewhere.
I'm not sure she wants that. It'll show up someplace. I'm tired now.
Okay, we are moving on to public comment. Clerk, would you want to read what needs to be read and?
Do I have to read the Zoom part? There's no one in Zoom.
We don't have anything. It doesn't.
But, okay. Okie dokie. So all public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of the Northern Nevada Public Health and its citizen during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. In addition, this meeting is being broadcasted via Zoom. So to comment via Zoom, please use your computer and, give me 1 second. It will require a computer with audio and video capabilities, and you can join the meeting by dialing 1-669-900-6833 and entering the meeting ID 820-9018-1273. In addition to that, if you would like to comment, please use the raise hand button, a feature during any public comment period. To provide public comment via telephone, only press *9 and *6 to mute/unmute yourself. In chair, we have Ms. Alexis Motorex for public comment.
Come on down.
Thank you, Mr. Chairman and members of the board. My name is Alexis Motorex with the Nevada Chapter Associated General Contractors, representing the commercial construction industry in Northern Nevada. We are here today in full support of the proposed revisions to the air quality regs you'll be considering under item 8. I'd like to take this opportunity to thank Francisco Vega and his staff for their willingness to listen to and address our concerns. He proactively reached out to us to make sure we were aware of the changes and took the time to meet with our members to discuss the regs on more than one occasion. He was patient, thoughtful, and deliberate in making sure the public is protected while accommodating industry to ensure these revisions did not create any undue burden. We genuinely appreciate his diligence and the partnership we have with Northern Nevada Public Health. Thank you, and happy Nevada Day weekend.
Thank you for coming. We always love good news. Do we have any other public comment?
We don't have additional public comment for this item, Chair.
Okay, very good. We're moving on to consent items. This is for possible action. And does anybody would like to pull anything, or do I have a motion to accept?
I move to accept the agenda items as posted.
I have a first. Do I have a second? Any more discussion? All in favor?
Aye.
Any opposed? Please vote on your computer. I think that passes unanimously. We are moving on to our public hearing for review, discussion, and possible adoption of the proposed revisions to the District Board of Health regulations governing air quality management, Chapter 20. And Francis, who do we have doing this? Oh, come on down. Is that Ben McMullen? Ah, welcome, Ben. Nice tie. You look good.
Thank you. Okay. So, good afternoon, Chair.
Yes.
I'm sorry, Mr. Chair, will you please gavel the hearing open and then Chair will gavel?
Sure. This is an open hearing officially. I skipped that. We just want to see if you're paying attention.
I'm paying attention.
Okay. Good to know. So am I.
Very cool. Good afternoon, Chair, members of the board. Ben McMullen, Air Quality Specialist for the record. Here today for possible adoption to the proposed revisions to Washoe County District Board of Health regulations governing air quality management, Chapter 020, General Provisions. The existing rule provides responsibilities for the District Board of Health, the Air Pollution Control Hearing Board, the control officer, and the regulated community. The rule revision was implemented as a commitment made by the Air Quality Management Division to NDEP and EPA to include language in regulation to satisfy the requirements of Section 110A2J of the Clean Air Act. This section requires that the public is notified of any exceedance of any primary national ambient air quality standard. The AQMD currently notifies the public of short-term NAAQS exceedances, these being 1 hour, 8 hour, and 24-hour averaging times, as defined in the emergency episode plan, but does not provide notification for the exceedance of annual standards. Next slide. Quick reminder of what other revisions we did. The AQMD also took this time to complete other revisions. As a reminder, formatting was updated, existing portions were clarified, and new sections, in parentheses, were added from other sections of existing rules. Since the business impact statement was presented and adopted at the September DBOH meeting, we made a couple additional revisions. These revisions include specifying working or calendar days for some requirements in part 020.100. We changed immediately to as soon as safely practicable in paragraph 020 100B2A. And we removed instances of he, him, his, and replaced with they, them, their, or removed altogether. And we did some additional public engagement between the business impact statement and today. An additional press release for the notification of the public hearing was done 2 weeks ago, and publication of legal advertisement was posted in the Reno Gazette-Journal on September 26th, October 3rd, and October 10th. So before the vote, does anyone have any questions?
Anybody? I want to say thank you for this process. These bylaws make a very big deal to many people out there sometimes decisions are made in these kind of meetings that have ripple effects, and so including them in the process is so crucial. And so we commend that, and as we go forward, I encourage that to continue. So thank you, even Ms. Alexis, for coming to share what you shared. And as we continue, this is so important, so your team did a fantastic job. Thank you.
Thank you.
With that said, I am looking for
Chair, we have
open meeting. Sorry,
we have
you're right.
public comment, additional public comment on
Okay,
this.
what else do you have?
We have Ms. Sarah Collins.
What was her name?
Sarah Collins.
Thank you. Come on down, Sarah.
Hello, my name is Sarah Collins, and I am with the Nevada Petroleum Marketer and Convenience Store Association. We provided public comment at the September meeting. We are just providing public comment. We want to thank the Air Quality Department for all of their input and reaching out to us as they met with us on multiple occasions. And we are in full support of the regulations, especially because our comments from the September are now in October. So thank you.
Thank you, Sarah. Any more public comment?
No additional public comment.
Okay. Speak now if you'd like. I'm going to go ahead and close this. I'm sorry, again? Vote first? Okay. I'm looking for a motion then?
Mr. Chair, I'd like to echo everybody's sentiments that the public outreach on this item was wonderful. Sorry, what did I say?
I'm sorry, again?
I don't know. What did you say?
I said, I was looking for a motion, but you can go ahead and.
Yeah, so I'm just going to do my motion,
Okay.
but I just want to say thank you.
Okay.
I move to adopt the proposed revisions to the District Board of Health regulations governing air quality management, Chapter 20, as outlined in the staff report.
We do have our first.
Second.
We have our second. And all in favor?
I'm sorry, Chair, did we take Dr. Clackings or Dr. Novak second?
Say that again, I'm sorry.
Dr. Clacking or Dr. Novak?
John beat Dr. Clacking. Sorry.
Okay, either way.
It was like one of those pistol draws, and so I took John's second. And so all in favor?
Aye.
Any opposed? Please vote on the screen. It looks like it passes unanimously. Again, good job.
Yeah, thank you.
And we really do appreciate the public comment, especially when we know we're trying to do a good job. So thank you. And now, you're welcome. Okay, we're moving on to presentation on lethal means reduction, Suicide Prevention Alliance, and we have Joseph Dibble. Come on down, sir. Two days in a row, I get to see you.
I know. How are you? Thank you for having me. My name is Joe Dibble with the Chronic Disease and Injury Prevention Program, and it's good to see you all again. I'm here to just bring to your attention some work that we're starting in the program on lethal means reduction and reductions in gun violence here in our community. If you've turned on the news recently, you've probably noticed that firearm-related injuries and deaths are prominent, within the news across the world and especially in the United States. When you dive into the data on firearm-related injuries and deaths, it's quite surprising to see that firearm-related deaths from suicide vastly outnumber firearm-related deaths from homicide. In fact, by a ratio of almost 2 to 1. Depending on the year, nearly 70% of all firearm-related deaths here in Nevada are actually from suicide. So firearms are probably the most lethal, or certainly the most lethal method of suicide when a firearm is chosen 90% of suicide attempts are lethal. So I'll refer to those as lethal means of suicide. Statistically, Nevada performs really poorly in suicide death rates. Nevada ranked as low as 7th worst in the United States as recently as 2019, and has since improved to about 12th in the nation based on age-adjusted suicide death rates in the last report, which was in 2022. In the most recent death statistics that I have available for Nevada and Washoe County are here. There were, in 2021, there were almost 700 suicide deaths in the state, and of those, 111 of those occurred here in Washoe County. Of those 111 suicide deaths in Washoe County, 64 of those were attributed to firearms or explosives. So again, for every 10 people who attempt suicide with a firearm, 9 will die. There's a much higher survivability with other methods of suicide, including only 20 deaths attributed to asphyxiation and poisoning or drug overdose. Suicide deaths were only 17% of those in the last report. Part of the problem with firearms is that it's difficult to intervene. So it's a permanent solution to often a temporary problem, and it's difficult to unwind the clock when a firearm is chosen. I wanted to just briefly explain a little bit about how thoughts of suicide could progress into an attempt. So this simple sort of 3-step theory is thought where oftentimes suicidal ideation can occur when someone is in pain and experiencing both pain, whether psychological pain or physical pain, and hopelessness. That can progress to a stronger ideation when someone, either perceived or real, has a lack of connectedness with their community or with their family or their friends. And that could lead to an attempt in some individuals, especially when there's when they have a capacity, whether dispositional, acquired experience, or like practical factors such as lethal means. Like, do they have something to attempt suicide at the time that they're capable of doing so? That third step is most important when addressing suicide, because addressing someone's access to lethal means, suicidal crisis can often be very short-lived. It can also sometimes peak in a very short amount of time and then subside. Often decisions to attempt suicide can occur within 1 hour of the thought, and identifying the individual in crisis, or that the individual is in crisis, and then helping create time and distance between that person and that and a lethal means of suicide can save their life. So in this model here, just quite simply, when another means is substituted for the most lethal means of suicide, this can lead to fewer attempts, or even a complete delay or permanent delay of the attempt, and then many times the suicidal crisis passes. I wanted to point out that individuals who survive suicide, 90% of them do not go on to then die by suicide. As many as 95% of individuals who attempt suicide and survive do not go on to die by suicide. This is why it's so important to look at the how, not just the why, of suicide. So one last boring model. The way we're going to address this suicide is not just a simple, straightforward model. We're looking at a combination of the complex interplay between not only us as individuals, but also how we interact with our, individual interactions within our interpersonal family, friends, our relationships, our community settings like schools, workplace, home, and also societal factors that create norms on how we solve problems and what's considered normal and what's considered acceptable. This model, which really interplays with each other and each of those levels affects one another, provides really an important prevention strategies on how we address these public health concerns and public health issues. So what I wanted to show you a little bit today was one of the first steps that we've taken here within my program, and that's get support. So kind of been able to identify about 13 different agencies to work together on this. We've started actual work on this, meetings for the last 3 months, and together we have not only greater impact, but also broader reach and more financial capability. But this is being led by Northern Nevada Public Health through the Community and Clinical or Injury Prevention Program. And we have suicide prevention advocates, we have gun owners, we have public health on board, and then we're also recruiting law enforcement. Furthermore, we have an advisory team of two mental health professionals. We have now 2 gun shops, local licensed firearm dealers on board to join and help provide some direction. And we've created both a vision and a mission. So our vision is really the collaboration, and our mission is to reduce suicide rates through this targeted education, through increasing awareness, and through decreasing stigma and improving safety education and the ability to prevent suicide at a community level. Our tagline, "Keep it safe and secure," is really guiding us, and you can see our logo up there, which is, there's a lot of symbolism in that logo. It's a gun-safe kind of look to it. There's a bridge there, partnerships, and obviously, the mountains in Nevada. I wanted to show, and I know I've seen multiple instances now on television, including watching the Game 7 the other night of one of the baseball games, but some public education messaging. This one was developed by Office of Suicide Prevention, which is helping us. I just wanted to show you an example, and this one's targeted to youth. Hopefully it plays. Can you get that to play, Susie? There we go. I didn't touch it, I promise.
I know I can be a little dramatic.
Oh my God! I can get a little mad sometimes.
The fact is, we're teenagers.
Look at those grants.
He's just a friend.
I haven't seen you in a month. No, get it. Sorry, this is over.
This breakup, it was terrible for me.
What? I didn't know how to fit in.
I even thought
It might be easier if I just ended.
Even though I'm young, I know what suicide is.
And most suicide is done with firearms. And mostly, they're from inside our own homes.
but you locked your firearms.
You locked your firearms.
Seems like such a small thing, but it could save a life.
You saved my life.
My life. My life.
You saved my life.
All right, so that's an example of a campaign video, and something that we'd like to do more of, social marketing type campaigns and suicide prevention campaigns. Two specific other projects that we are working on. One of them is a safe firearm storage map. So there's been a couple several examples of these developed nationwide where we use like a Google technology and identify anywhere that's willing to temporarily, voluntarily store firearms during time of crisis, and help those locations sort of weed through and solve and not get too wrapped around the axle, I guess, per se, of the legal issues with that, so that when someone's in a time of crisis, there's a location where we can displace a family member or whatever can displace lethal means, medications or unused medications and firearms and other means of suicide. So this interactive map we think would be very valuable in Washoe County and could even be expanded statewide. And so we're actively working on that. And then a gun shops project. I mentioned we do have partnership now and involvement with now two gun shops that are willing to help not only provide input for our messaging, that's critical to their customers and their understanding of their customer base, but also promote and share our materials with their customers so that it gets more out into the community and help us develop some of the, messaging and maybe even be a sort of a volunteer for some messaging and some of that, campaign work. So it's a great effort. I think personally, everyone that's been involved, I can say, is touched by suicide in one way or another, and in this, I think I really have high hopes on the things that we can do here. That's it.
Thank you. Any questions, thoughts? Dr. Keckman?
I have a couple of questions here. First of all, so 75% of suicides are male, and approximately, and also the Mountain West has the highest suicide rate in the nation, I think, still, correct? Do you know?
The Mountain West region?
Yeah.
I'm not sure regionally.
Yeah, so it did up till a year or two ago, so I assume it's still the same. Have you seen any effect from the 988 number yet that went into effect nationally about a year ago?
All the suicide death statistics that we have availability, there's about almost a 2-year lag about when they actually get published, I think through the death registry process, and most of them come out through the CDC. So I don't have anything current on what 2020, I've got some rate for most of the data that I have ends for death rates end in 2021. So I don't know yet on the 988, but I'm hopeful. Mm-hmm. I think it's a great resource, and I don't think it's a recognizable number, just like 911 is, and I think it's a consistent tool that we can use and promote. So we're definitely promoting 988 in our materials.
Thank you.
Ms. Garcia.
Thank you, Mr. Dibble. This topic has been coming up a lot. It's been in the media a lot. We've discussed it, through the lens of the school district. We've talked about it just as early as Tuesday at our strategic plan in relation to senior suicide, which is double the national average here in Washoe County. So we're feeling it on so many fronts in so many different zip codes and population ages. And I really appreciate you bringing together the list of advocates who you're working with, and it sounds like you've done some work in relation to creative approaches like working with the gun shops and promoting those gun and medication storage options. The PSAs are obviously have a wide net that we can cast. I was just curious to see if you or your team had considered doing more kind of boots on the ground events or town halls. And if so, there's a model that I just attended, the Forever 14 nonprofit in cooperation with the Great Basin Chaplain Group, hosted a town hall setting type meeting in South Reno that I attended that showed a film about a young lady, teenage girl, who shot herself but survived and ended up in a wheelchair and lost mobility. And so it was just incredibly powerful film. So it was to highlight the film. The place was packed, and it was what I really liked about that approach was that it wasn't just the usual suspects. It's not just elected officials or policymakers, or folks that are specialists in this field. It was moms and dads and leaning over and grabbing their sons and daughters during the film. It was a very, very powerful approach, and so I was just curious to see if we could maybe consider down the road partnering or supporting or helping promote those types of efforts, because I really did think they got down below a typical layer that a local government or agency can really touch.
I think with the ability, so we're strategic planning now about how we're going to proceed and when we're going to be able to get out and get sort of boots on the ground. But I think with the collective group that we have a lot more ability to do that. And then also taking that approach that we're taking, which looks at the community settings and societal and interpersonal, and strategies to go and touch each of those areas and each of those factors is going to lead to that. Mm-hmm. So, I think it's a great idea. I actually first learned about that campaign that you mentioned just on Monday. Mm-hmm. So I think it's great.
Well, I can echo what was just shared over here. I just think it's so important. Obviously, the mental health portion of what we see happening, and it's hitting every layer of need, and so to continue to help educate the best we can. So I'd be interested in when your guys' strategic plan is done of what some of the strategies are to see how and where we can come alongside, whether it's individually or as a board. But I think it's such a huge thing. We do a lot of work on looking forward to our health initiatives. This to me seems like something that we should pay attention to.
Thank you.
Thank you.
I'm happy to share that, and that'll be for our specific group, for that alliance.
Thank you so much. Come. I think we're good. Thank you.
Thank you for having me.
Glad you're here. Moving on to 10, presentation of the Active Managerial Control Program for Food Safety, and Olivia Alexander, leader. And is it Maya or Mia? Mia? Thank you. Mia Gazip.
All right. Hi, good afternoon, Mr. Chair and members of the board. Thank you so much for having us today. My name's Olivia Alexander Leader, and I'm an environmental health specialist here in the EHS division. Today I'm here with my fellow specialist, Mia Zeb, and we're going to be talking to you about our active managerial control program that was rolled out this last summer. And I do want to just say that this presentation corresponds to the article that Mia and I co-authored for the Journal of Environmental Health, the July-August edition, as well as the presentation that we delivered in New Orleans at the National Environmental Health Association's annual educational conference. So thank you so much. We're excited to share it with you.
All right. So we're going to kind of get into what are active managerial control programs, Northern Nevada Public Health Journey to AMC, AMC program benefits for health departments and their jurisdictions and the communities that we serve, and why would somebody institute one of these programs. Increased workloads and understaffing is a growing trend among all public health fields, including environmental health agencies. Many agencies are struggling with growing communities contributing to higher workloads, burnout and high turnover rates leading to understaffing, and decreases in funding leading to decisions about which services can be provided. In the field, we hear from our retail food establishments who are dealing with similar issues. Increased workloads due to higher demands from customers and understaffing as a result of high turnover and burnout. Less available money due to increased food costs and employee wages. When retail food establishments are faced with trying to do more with less, food safety is often one of the first things to be overlooked. So active managerial control is a tool to help solve some of these problems. So what is active managerial control? By definition, AMC is the purposeful incorporation of specific actions or procedures by industry management to attain control over foodborne illness risk factors. So what does that mean for us? In order to help restaurants accomplish active managerial control, we use our AMC program, which consists of 2 parts. The AMC course, where operators can share challenges they're facing and learn about AMC and how to create their own policies. And the AMC Toolbox, which is a free online resource comprised of up-to-date visual and written food safety resources. So in 2021, the EHS division conducted a self-assessment as part of the FDA Retail Food Safety Program Standard. At that time, our compliance and enforcement policy was largely focused on working one-on-one with non-compliant operators, which was unattainable due to lack of resources. In order for our program to be both effective and efficient, we would need a proactive policy that increases our operator buy-in to food safety practices and empowers operators to self-develop food safety management systems and addresses multiple food establishments simultaneously. Mapping the needs of our jurisdiction as it relates to our compliance and enforcement policy was helpful in steering the later creation of our AMC program.
All right, so following that Standard 6 self-assessment, we applied for the NEHA FDA Retail Food Flexible Funding Model Grant, and we were happily awarded that. It is a 3-year grant for $300,000, so about $100,000 per year. It started, our year 1 was 2022, and that was primarily our information gathering year, where we learned about how to develop a program. We reached out and discussed with other jurisdictions, and we were able to really conduct a lot of great information sharing. Our year 2 is this year, where we officially roll out the class and our toolbox, and we are currently in the process of developing 12 food safety videos to help instruct our food establishment operators. And we're really happy to say that 6 of those videos are in English and 6 of them are in Spanish, so we are able to reach our limited English proficiency demographic in our community. And then our year 3 is our public workshops and community outreach year, which we're also really excited about. And we're going to utilize the rest of that funding to create 3 final food safety videos in terms of reaching out to our community and letting them know about the program. So right now we're in year 2, like I said, and we had our first class in July. And actually our most recent class was in here just yesterday. It was a really great success. We tested out a new closed captioning on our PowerPoint, again, so we could have our speech translated into Spanish as we were delivering the presentation, and that was really exciting for us to be able to reach that population. And so what do active managerial control programs do for our environmental health departments? As Mia mentioned earlier, we're dealing with a lot of competing challenges, and that's nationwide. And so our AMC programs is largely based off of Maricopa County's AMC program. And after they had implemented theirs, they reported a 41% decrease in enforcement actions taken following the institution of their program. And so we're anticipating seeing similar results in our jurisdiction as well. And we're anticipating to see a decrease in the number of re-inspections, a decrease in the number of critical violations observed during those inspections. We're hoping to see and to generate long-term consistency and compliance. And then, of course, our shared goal in this room is, of course, to protect public health. One of our primary reasons for wanting to decrease the number of re-inspections is so we can focus on routine inspections. Our research has shown that routine inspections have a much greater impact in terms of protecting food safety at establishments, just because they're a little bit more comprehensive. So we are excited to learn more about that, and we've just started to collect some data from the first couple iterations of the class. And so what do active managerial control programs do for operators? This was a huge consideration for us. We really wanted to show our food establishment operators that we're partners with them in protecting food safety and in creating a culture of food safety through to helping them to develop active managerial control policies, so the appropriate procedures, training, and monitoring steps for them. We really wanted to increase efficiency and success in their establishments, not only for ease of owning and managing a business in our community, but also for protecting their patrons and our community's overall health. And then once again, it can't be said enough, we want to protect our public's health. And of course, this program was primarily motivated by our community. We really wanted to provide an avenue for our local businesses to develop food safety policies that are often developed on a corporate level for chain restaurants and chain food establishments. And so this is a grant-funded project, obviously, so it's free to the establishment operators, and it provides them the tools and resources necessary to develop these policies for themselves. So it hopefully reduces costs with a big benefit for these local mom and pops. We really wanted to reduce food waste. When food is improperly handled in these establishments, it does have to be discarded in order to protect the public health, and hopefully by helping facilities to develop proper food handling procedures and stick to them and properly train their staff, we'll be able to reduce food waste in our community. And we want to improve equitable access to information. So that kind of touches on that first point as well, just making sure that our local business owners and our mom and pops have access to the same food safety information that the corporate or chain restaurants and establishments do. And then also with offering the program in our resources have been translated into Spanish and Chinese. And then we are still developing, but making great strides towards offering the class in Spanish. We're hoping to improve that equitable access as well. And all of this is, again, motivated by our goal of protecting public health and ensuring that when people go out to eat, ourselves included, we can feel really comfortable and go home just feeling happy, satiated, and healthy. And I do just want to say thank you to the board for having us to present today, and then also thank you to our wonderful team members who help us to lead the class and have really supported the development of this entire program and constantly listened to input and provided input, and it's been a really awesome team effort. We're super excited about it. Thank you so much.
It's wonderful. Let me open it up for questions or thoughts. Mr. Novak.
Just have one comment. I think this is great. Be proactive and across the whole community. It doesn't seem to be mom and pop. It's not corporate. It's to benefit all of us. And thank you for being proactive.
Yeah, thank you. One of the things we're so excited about too is just that everybody kind of gets together for the class. So even amongst operators, they're able to share. There's a kind of collaborative group activity that's part of the course. And so even at that time, they get to information share and collaborate in that sense. So it's community building as well as food safety policy building.
Commissioner Garcia.
I was just thinking that the bringing together of folks and that community building is so positive, and it has such a larger ripple effect because they all know other business owners, other restaurant owners, and that word of mouth definitely travels strongly in certain communities. I'm just curious about the actual classroom setting, and thank you for the language access focus and emphasis in improving that outreach. But what are you learning or seeing? What are the sentiments of your classmates in terms of just those aha moments, or maybe some common misconceptions or common areas where they falter?
One of the really cool things that I've seen in a couple of these classes is, years ago, the focus was just, here's your violations, you just fix it yourself. It's really changed to a much more collaborative approach from the inspectors with the operators. And so a lot of them they didn't have the tools to write policies. It was just passed down training, word of mouth. So to actually have a policy that they can quickly reference and a training program that they don't have to reinvent the wheel every single time. It just, the hope is that it's taking that off their plate where it's just it's already there for them, and it does give them the tools to do it themselves. So we have had a lot of people, thanks, I didn't even realize that this is something I should have been doing, so.
Thank you for your work.
And I think, just sorry to add on to that as well, one of the things that I think is really exciting is that when people get together in the class, they see that they're not the only establishment struggling with a violation. And we are able to kind of help people develop a policy for a violation that was observed during their routine inspection. And I think it's really valuable for them to be able to see oh, okay, it's not just me, other people struggle with this. Mm-hmm. And then also there's other people, that don't struggle with this. So it's possible to move past this violation and hopefully move into a more positive food safety space.
Well, we were just at Cracker Barrel this morning as they opened up, so I tell you what you just said is so important. I do want to ask, do we ever utilize this to encourage those that are new? Obviously Cracker Barrel probably knows what they're doing. They've been doing it for a while, but new people open restaurants, but then also anybody who we find are getting more struggle than others. Are we able to really encourage them to come this way? Is that part of your outreach?
Yeah, so right now the active managerial control program is built into our compliance and enforcement policy. So if you receive more than 3 critical violations during a routine inspection, it is mandatory to attend. However, it's also available on a voluntary basis, and the more that word gets out in the community, hopefully the more people are going to sign up for this program. And then additionally, that's kind of part of our year 3 plan, is that community outreach as well, and just making sure that the word is out, that active managerial control course is an option, and hopefully, fingers crossed, new restaurants will sign up to send their managers and change makers to this class.
That's fantastic. I'll end with this, is that I think part of our largest goal we do is to educate. So you are hitting it right on the head for me. So thank you.
Thank you. Us too. Thanks so much.
Very good. We're moving on to 11, Regional Emergency Medical Services Authority. And we have a report, a monthly franchise report for September 2023. And we have the Barry DePlantis.
Good afternoon, Chairman Dare, and members of the board. I am Barry Duplantis, CEO and President of REMSA for the record. I understand you've been provided with a copy of REMSA Health's September 23 report, as well as a document that talks a little bit about the growing areas of our community that we relatively consider to be challenges, or what we would call hotspots. For the fiscal year to date, REMSA Health has been compliant with all priority 1 calls in zones A, B, as well as zones B, C, D. However, during September, performance in the Cold Springs area caused us to dip in our performance to 89.4 and relative to our commitment of 90%. That said, we've increased our commitment to the Cold Springs citizens by placing a staffed unit in the area to bolster our ability to respond quickly to priority 1 calls in that area. Accordingly, in the August meeting, a question was raised about what we consider to be areas of challenges, kind of the hot spots. And I've provided you with a document today outlining what those 4 areas are. Because these are areas that we're constantly reviewing and determining how do we best position our assets to respond to these communities. Cold Springs, as I just referred to, is one of those such areas. The call volume is very low in that area. And as we look at that, we're constantly asking ourselves, what do we need and where? But one of the things that we've done most recently to address particularly Cold Springs is we had have a camper unit that we actually purchased about 2 years ago when there were fires in the California area, and we supported our care flight operations in the Greenville area where the fires were taking place. We've since had that unit in storage, and it was an opportunity for us to put it at Bordertown, where it's just uniquely positioned for us to address the issues in Cold Springs. Other areas that are certainly on our radar where we continue to watch, Verdi is a growing area, and we've positioned a unit at Robb Drive to best cover that area at the present time. Spanish Springs, as well as Washoe Valley, are 2 other areas of growing populations. And in those 2 areas, we've bolstered our support using Truckee Meadows Fire Department, who's got operations in those areas where we're able to collaborate to cover the citizens of those areas. And then on another note, as required in our franchise agreement, our audit of our fiscal financial statements, our penalty fund account, and our average bill is underway. And we expect to have the audited report of these audit reports to present to you in September. Generally, we get them about second week of December. So we will share those with you as soon as we get them. At this point, I'm pleased to say that our operations are going well, and I'm happy to take any questions you may have that I can help address.
I want to say thank you. This is exactly what I asked for. So one of the things for me, and I think for all of us, there's a lot of information in here that we can continue to look through, and thank you for providing the report as franchise agreement agrees to. But this kind of information is what we're looking for. I was looking for. It kind of helps us as a region kind of see. But I also want to say this real clear. I believe as we grow, I know you guys are doing your best to keep up with it, but it's all our job, especially all of us that are elected in our cities, to pay attention to try to help where we can. So we want to see where it's there, and it doesn't mean all the responsibility is on you just because something's a harder place to get. You didn't zone that, I did, whatever. And so it's something, as we create this, we need to know what are we causing, what is happening, so we can adjust appropriately and pay attention to it. So we want to know. So that's part of why I asked for this, for everybody to be able to see pretty, like a snapshot of what you guys are seeing each day and keep us up to stuff what's going on. So thank you.
Thank you. I might also add on that very note, we certainly are not operating in a vacuum. We have collaborative meetings, particularly with the fire agencies, so that we can understand how we might be able to help each other even more as we move into the future. Regionalization has certainly been, shall we say, the catalyst to move in that direction of thinking. But I'm very pleased with the collaborative discussions that we're having amongst all of our partners.
I love hearing that. Anybody else? With that said, we are looking for a motion. I have a first. Do I have a second? I have a second, Dr. Clacking. And any more discussion? I see none. All in favor?
Aye.
Any opposed? I believe that passes unanimously. Thank you. I appreciate this.
Thank you.
We're moving on to recommendation of the reappointment of a person to the Emergency Medical Service Advisory Board for the Hospital Continuous Quality Improvement Representative, and the recommendation of the program for reappointment is Joe Macaluso for a 2-year term beginning November 2nd, 2023 and ending November 1st, 2024. Andrew Esp.
Hi, Chair, members of the board, Andrea S., Preparedness and EMS Program Manager for the record. You do have the report in front of you. I did want to note there was one clerical mistake in that report, that the date ending of this term is actually November 1st of 2025, not 2024.
I should have caught that too. I said 2 years. You're right.
I read it twice. I should have caught it too.
Is there any questions? Very good. I'm looking for a motion. First, Mr. Novak. Second? Second. I have a second. Any more discussion? Seeing none, all in favor? Aye. Any opposed? And that passes unanimously.
Okay, thank you.
Thank Joe for serving. Fantastic. We're moving on to 12. 12, recommendation to uphold the decision of the Sewage, Wastewater, Sanitation Hearing Board to approve variance case number H23-0003, VARI to the Northern Nevada Public Health Regulations governing sewage, wastewater, and sanitation. Farado Lane LLC, owner of 2474 Farado Lane, Washoe County, Nevada, assessor's parcel number 222-060-25.
Good afternoon, board again. Robert Vita for the record. I have with me Latricia Lord. She's going to go over this staff report. She's a subject matter expert, so I'll have her kind of brief you, and then we'll open it up for any questions.
Thank you.
Good afternoon, Chair and members of the board. Latricia Lord, Senior Environmental Health Specialist for EHS, for the record. So as you probably have seen in your board report, we were presented with an application for a variance request to our septic regulations associated with a single-family dwelling that was being built at the subject property of the 2474 Farado Lane. The request was to allow for a reduced setback from their septic system to a drainage channel on the property, resulting from water draining from their property and nearby properties. The applicants have proposed mitigation measures that we feel are sufficient to protect public health, and it has been heard and approved or recommended for approval by our Sewage, Wastewater, and Sanitation Advisory Board. And we agree with their recommendation. We feel like the mitigation measures are sufficient to protect public health in a variety of situations that may happen over the years. And so if there's any questions, I'm happy to answer them.
Any questions, concerns? I see none. I'm looking for a motion. I have a first. Do I have a second? I have a second. Any more discussion? See none. All in favor? Aye. Any opposed? I see none. That passes unanimously, and we're just waiting for the computer. And there you go. Congratulations. Good job.
Have a good day.
Thank you. We're moving on to community and clinical health services fee revisions. And Lisa Latritz and Jack Zentino. Zentino or Zentino? Zentino. I said it right.
Good afternoon, Mr. Chair and members of the committee. My name is Jack Zentino, and I am the Administrative Health Services Officer. We are going to discuss item 13, which is approval and adoption of revisions to the fee schedule for the Community and Clinical Health Services Division. And if they are approved, authorize community and clinical health services to increase fees yearly using the Consumer Price Index for the Western region through December of 2028. So if it works for you, Mr. Chairman, I'll just provide a quick background, how we came about this, and just open it up for questions. So the current logic came around in 2015. It was created around what's called a resource-based relative value scale. Essentially, you take the total cost of the work, you list out the goods and services that are provided, you do a relative value to those activities based on fee tables that come out from CMS, and you make adjustments based on GPCI, which is just a regionalization of those costs. You divide it all out, and what you get is a relative value for each activity that's provided. This gave us a baseline for our fees. From there, we had some conversations with our staff. Sorry, I'm going to go to buy my notes so I don't say anything weird. Sorry. So we put together the fee tables based on that information. We sat down with our staff, put the information down on paper, discussed it with the subject matter experts, made some revisions based on the information that was available at local hospitals, pharmacies, FQHCs. We looked regionally. We also looked statewide, Southern Nevada Health District. And based on all of that information, you have the draft tables that are in front of you. This was a pretty exhaustive process. We spent a good chunk of time just making sure that we had conversations with the subject matter experts, making sure that we talked to the other folks that are doing the activities in the community, making sure that we met the needs of the population that we're trying to serve with each activity. And based on that is the information that you have in front of you. So that's all I'll really say about it, unless you have questions for me. I can answer them from a mathematical, conceptual perspective, and then I've got Lisa with me if there are any programmatic questions.
Go ahead and continue. Were you going to share something too?
I'm here to
Answer questions. I think the only question I have, and I mean, without question, obviously things cost more, and that's why we do what we do, and we continue to go forward. I'm just thinking of someone, though, who's on a fixed income, and I see some of the costs of some of these. I actually read through this going, $772.23. Wow. And I say that, I don't know who uses some of this or how that's used, but a lot of this is covered by insurance. So is this hitting our most vulnerable population and these high things? I only say that, not that it doesn't need to happen maybe, but I'm just wondering.
Yes, Lisa Lottridge, Division Director for CCHS, for the record. A good question. A lot of these things are covered by insurance, and what we have done in our family planning and sexual health program is have a sliding fee scale. So based on that person's income and their family size, they can actually slide to zero. So it can be 100%, 75%, 50, or 25, or zero. And we use the federal poverty guidelines that come out every year, and we adjust based on that. So, and again, if someone, what we're there for is to ensure people get the care they need. So we do not refuse service if someone does need care, and we can bill them if need be. So they would not be refused the service. But definitely we have that sliding fee scale, and we do bill insurance if they have it.
Thank you. That definitely helps my brain. When I looked at this, I was like, wow. Yeah. I know what Social Security some people get, and they're done with their medicine. Any other questions? Okay, thank you so much. I'm looking for a motion then. I have a first. Dr. Novak's busy today. Second. All in favor?
Aye.
Any opposed? That passes unanimously. Thank you.
Thank you.
Thanks for all the hard work. I know a lot goes in behind these things that we don't even know. Presentation and possible acceptance of the FY24 Q1 strategic plan results. Miss Julia Ratty. Actually, you're not Julia.
I'm not Julia, I'm Rihanna.
Good afternoon, Chair and members of the board. My name is Rayana Lavoy, Management Analyst with the Office of the District Health Officer's Office. Today, my presentation is going to be very short. I'm going to talk about some of the new changes that we made to our ClearPoint results, but in your board packet, you have the Q1 strategic plan results for fiscal year 24. Our ClearPoint system is our performance management tool that we use, one, for accountability so that we can ensure our teams are in alignment with our organization's strategic plan, but also for development purposes to make sure that our staff have the tools and resources they need to hit the targets that we've set out. New in your packet, you will see that there's a black circle, and that is a volume indicator. And so in a couple of weeks, we're going to have a board retreat, and Julia and Erica Olson from On Strategy, they're going to go more in depth with this. They're also going to talk about a data dashboard that we are developing. But our volume indicators were created to measure the number of services delivered or activities implemented. And really this gives us an idea of what we as an organization do here at Northern Nevada Public Health. So this is a fantastic tool to tell our story. And like I said, you guys are going to hear more about it here in a couple of weeks. I'm going to go over the initiatives and the outcomes and the goals, but you can see that we've made a lot of progress so far. Over 50% of our initiatives have been achieved, or they are on target. Similarly, our outcomes, about 50% of those are on target, with our goals following behind. We've got 60% of those on target, as well as our district goals, which are also about 60% on target. So we're making great progress so far for Q1. And with that, I'll take any questions that you might have.
Any questions? We're looking forward to our board retreat. I know we always go through a lot of this more in depth and strategic portion, but good job. Thank you.
Thank you.
This is for possible action. Would you like us to do that? You want us? It says it, so we'll do it. Looking for a motion to accept. I have our first. Do I have a second? I have a second. All in favor?
Aye.
Any opposed? Passes unanimously. Okay, we are moving on to our presentation and possible acceptance of the annual FY23 Health Equity Plan results. And this is Camarina Agosto.
All right. Good afternoon. I'm Chair and members of the board, Camarina Augusto, Health Equity Coordinator. I'm the Office of the District Health Officer for the record. And today I will be providing a presentation on the Health Equity Plan Annual Report. So to provide some background, in May of 2021, NNPH received a CDC Reducing Health Disparities grant. So through that grant, we were able to bring on a health equity team of 7 staff members. So that included my position, the health equity coordinator, 3 community health workers, 2 community organizers, and a media and communications specialist. Included in the scope of work through the grant, we were also able to contract with an external consultant to support health equity initiatives at our organization. And so with this increase in funding and resources, it was a really good opportunity for us to build organizational capacity. So that led us to implementing a health equity organizational capacity assessment and plan. So the assessment that we selected is the Bay Area Regional Health Inequities Initiative, known as BARHI. The reason we selected this toolkit is because it's specifically made for local health departments to assess the skills and characteristics that staff in the organization needs to address health inequities. And the toolkit is pretty comprehensive, so it included a staff survey as well as a collaborating partner survey. So through that collaborating partner survey, we were able to reach out to our partners and stakeholders, and they evaluate us on how they think we are doing with equity work. The toolkit also included staff focus groups that were randomized across all divisions and management interviews. So this timeline provides a snapshot of the process. So in March of 2022, we reconvened an internal health equity committee. So that internal health equity committee has representation from staff across all of our divisions. So in May of 2022, kind of the first project that the committee had, the consultant in our organization, was to implement that health equity capacity assessment. That took us a few months to complete, and in September of 2022, we held a health equity planning retreat where we met with our health equity committee, and we were able to review the results of the assessment and also have the committee prioritize which recommendations they would like to see move forward in a health equity plan. In October of 2022 is when our health equity plan was officially developed. We wanted our health equity plan to be a living and breathing document, and so we took the extra step to integrate the health equity plan within the strategic plan and our performance management system so that we could track progress made on the plan. So now I'll jump into our plan. So it is an internally focused 3-year plan. It runs on a fiscal year timeline, and the plan includes 7 overarching goals. The intent of the health equity plan was really to infuse health equity across the organization. We just didn't want health equity work living within the health equity team, but we really wanted to build that organizational capacity so health equity work could be infused across all programs, across all of the divisions. And this work really couldn't have happened without the support of our health equity committee, our division directors, and our leadership. So now I will transition over into our Health Equity Plan annual report. So we have finished the first year of the plan, and the report details the progress made in fiscal year 23. The report outlines the achievements that were accomplished, and it also includes a color coding scale to assess the results and the progress that was made on each initiative. The first year of the plan included a total of 26 initiatives. We're happy to report that 92% of those year 1 initiatives were either fully or partially achieved. There was 1 initiative that we did not achieve in fiscal year 23, and then there was 1 initiative that we did not yet start. So I'm just going to, at a high level, to share out some highlights of the annual report. I will start off with training. So our external consultant provided diversity, equity, inclusion, and cultural competency training for staff. This training was voluntary, and so we were very excited to see the response from staff. So we had about 93 employees across the organization complete the training. We've also had the ability to work on cross-divisional projects. So the health equity team has collaborated with other divisions. One of those I would like to mention is we collaborated with our air quality management division on a Purple Air project, where we worked with community-based organizations who reside in underserved zip codes and areas to receive an air monitoring system where it did not currently exist. And so they would have access to that information to be able to make more informed decisions on days where air quality may be poor. For our communications team, they've been able to develop a Spanish Facebook page. We've also been able to reach the Hispanic and Latino population in a pretty unique way. So we actually hold bi-weekly Spanish radio segments, and that is an avenue where we share and promote public health messaging. And the communications team has also been able to develop linguistically and culturally appropriate public health marketing campaigns. For the strategic plan, the organization updated our mission and values to reflect equity and inclusivity, so we were very happy to see that. And another highlight I would like to mention is in 2022, Washoe County holds their Impact Awards, and NNPH and the Health Equity team received an Impact Award for an internal program that made an organizational impact through positive change. So now that we've closed year 1, we are looking ahead to year 2. Some of the next steps include reevaluating and updating year 2 of the health equity plan for any necessary updates that the committee would like to see, continuing to meet with the health equity committee as well as those working subcommittees, and then to begin implementation of those year 2 initiatives. And to give you a glimpse into what some of those year 2 initiatives include is language accessibility. So we really want to look at literacy level, accessibility, and translation needs for our organization's most vital documents, reviewing the hiring, retention, and recruitment process with an equity lens, continuing to provide those in-person training opportunities that staff responded well to, as well as adding health equity partners to our community health improvement plan. You've received a few presentations about that project from my colleague Rihanna Lavoie, so making sure that process continues to have an equity lens and add those partners. And then as well as continue to develop additional culturally and linguistically appropriate public health information campaigns. So that is the close of my presentation, and I'm happy to answer any questions.
Anybody? You did good.
Thank
Very
you.
good presentation.
It's
Thank
a
you.
team effort.
I-
Takes all of us.
I hear that from all your team. That's always a good thing. They all say the same thing. Team effort. So we agree with you. Thank you so much. I'm looking for a motion to accept. I had two firsts and a second, so you guys can fight over there. Dr. Kutkin had a first. I'll do a second with John Novak. And all in favor?
Aye.
Any opposed? Passed unanimously. Thank you so much
Thank
for your
you.
hard work. And thank your team, because you won't let me thank you. So, and we are moving on. Number 16, review and approval of the District Health Officer's annual performance evaluation results and approval of 5% annual merit increase. Lori Griffey.
Good afternoon, Lori Griffey, HR representative for the Health District. We are here to go over Mr. Dick's annual evaluation survey. It was distributed on September 28th to 39 different participants. A reminder was sent on October 9th, trying to get some more participation in it. The evaluation closed on October 12th. The District Health Officer's evaluation results are in your packet, along with all the comments that were provided throughout by the participants. 24 out of the 39 invited participants actually completed the survey. We had 61.5% participation rate. Each survey had a specific question that said, select the best statement for the overall evaluation of the District Health Officer, Mr. Kevin Dick, and 100% of the participants rated him as meets or exceeds. So we're doing good. Answers to all the other questions for the three surveys were combined together, except for the no basis for judgment. A total of 213 responses were received. Out of those, 61.5% rated Mr. Dick as exceeds their expectations. 37.56% rated him as meets their expectations, and less than 1% rated him as areas for growth. The comments in this have been included in your survey, so you can read each one of those if you'd like. We recommend that the board accept this evaluation as presented. The board does have the option to discuss the review with Mr. Dick and outline any possible goals for the coming year. The board did vote in July 27, 2023, to move the district health officer to a higher wage range, which was part of the Washoe County Corn Ferry reclassification, which that also makes Mr. Dick eligible for a 5% merit this year. We recommend that you approve both his valuation and a merit for him for this year.
Thank you. Any questions, concerns, conversation? Going. Thank you all who took part in this. I would say it looks like I see a few of our board members did not respond, and I hope in the future, I'd like to say we'd like to make sure our board does respond to this. So I know it goes out in format, and so maybe you didn't get the email or didn't see it, but please make sure we do that. And with that said, this is just a normal process of what we kind of walk through. So with that said, with no further conversation, I'm looking for a motion.
Move to approve the district health officer's annual performance evaluation results and approval of 5% merit.
We have a first.
I'll second.
I have a second. Any more discussion? All in favor?
Aye.
Aye. Any opposed? It passes unanimously. Thank you.
Thank you.
Very much. Okay, we are moving on to presentation and discussion of possible decision regarding the recruitment process to fill the district health officer position, authorizing the chair to work with Washoe County Human Resources to select an executive search firm to conduct a national search for qualified candidates to fill the position, to develop structure and process for the national search and selection of finalists for consideration by the District Board of Health, and to provide regular updates to the board and the process and progress. Let me just kind of tell you, we met with HR, and I think the meeting went very well. That was Washoe County HR that we met with, and they are we have access to them, and they had very good ideas. What I'm asking us, and seeing if we agree to this at large, that we go out and we allow HR to help find us some firms. They've already kind of started that process, but this kind of seals that deal that we're moving forward. And then those firms, we'll find, we'll make decision on who that firm will be. I'll walk with they'll give me a couple of things I can determine. If I have any questions or anything seems out of the norm, we can be in communication, but I'll help that process move forward. Our ultimate goal is to open it up nationally and do a national search. If someone local wants to, or someone who works here, they are welcome to do that. No one's saying that that can't be a local person. But as that opens up, then we will walk through process. And our goal ultimately is to bring 3 people here through all the process. And we'll talk a little more about that process once we get someone in place. But our goal is to have at least 2 to 3 people that can come before us, and we'll have them do an interview with us, and we'll make that final decision together as a team, as a board. So that's what we're kind of asking today to start that process. There's a lot more conversation to be had, but some of that we should wait probably for us to actually hire someone who's going to come with some ideas. Any thoughts, questions, agreements? We good? Very good. Okay. With that said, I'm looking for a motion. I have a first. Do I have a second? I have a first and second. Any more discussion? All in favor?
Aye.
Aye. And any opposed? Very good. I do want you to know, on a side note, I've asked our health officer, Kevin Dick, to be involved with me on that process. He'll be a guy in the corner kind of watching and being a part of that, but I'm also very much want his opinion on this. I think he's done a good job, and we want to make sure that this handoff goes very well as we move forward. So, but we'll be in touch, and we'll bring more to you as necessary. So thank you so much. We're moving on staff reports, and Francisco's ready to go. Man, he's hopping. Go for it, sir. Air quality management.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I would like to provide additional information on a couple items in my report. The first one being the climate reduction pollution grant. Climate pollution reduction grant that was notified, or that was put out for notice by the EPA, I want to say 2 to 3 weeks ago, but this is a tremendous opportunity for our community and region to make some real transformation when it comes to combating climate pollution. And so just a couple of things there. Myself and the Washoe County Sustainability Manager, Brian Beffert, in addition to the City of Reno Sustainability Manager, Suzanne Groman, are in discussion as far as what this might look like for our region. I want to thank Chair Dare, obviously, for organizing a meeting between ourselves and RTC as well, so we can kind of initiate this conversation from a transportation perspective. But again, this is kind of a big deal. I don't think something like this has really happened that I'm aware of really ever. So again, $4.6 billion. Right now, the NDEP, the state's, the Nevada Division of Environmental Protection, is kind of leading this effort. We actually met with them yesterday as far as what that might look like for us in Washoe County. We got a lot of really good information. One thing I did want to mention is we're under a pretty strict timeline as well with planning portion of the grant due on March 1st of 2024. And then the implementation part of the grants due a month later in April. Again, this is a big project. I will say that not just one jurisdiction is going to be able to kind of carry the entire load. So I'm going to look for kind of board member support in trying to organize some of this and really to make this a reality. The state's willing to pick up some of the effort, but again, as far as what this looks like from our region, it's going to be kind of upon us on what that's going to look like. So mention some dates there that are really critical. Just a couple of other items. The grants are really going to kind of emphasize on major transformations within the region. So this is going to be super competitive, and EPA is looking for, again, major changes within the region. And they're also looking for collaboration within different partners within the region. So lots of information there, and we're going to try to inform ourselves as we kind of navigate this process. But again, not a lot of time there. The other thing is, during today's consent agenda item, the board voted to approve a recommendation for one of air quality's penalties. I just want to really recognize air quality's hard work and in navigating those compliance and enforcement processes. Since I've really started as a director of air quality, one thing that we've been trying to break down is this mindset that we're just regulators. Really what we're trying to do is help and empower business and industry with compliance. So trying to work with them hand in hand, and again, really the focus there is compliance. So this was a really good example where we worked with Empire Mine on obviously working through some of their issues, and the focus was on moving forward. How do we address this and protect public health? So I just wanted to mention that and really kind of recognize air quality staff for that. Happy to answer any questions.
Thank you. Any questions?
I'd just like to say I think this is a great opportunity if we can get Reno Sparks and Washoe County together to go after this and go after it hard. He's up against, or we're up against the 50, it's going to be the 50 top population areas of the United States are really going to go after this, correct? After this money. And
that's correct.
And my understanding is Las Vegas is doing their own on this. So we've got to get the state and our local communities behind this to really push forward. Again, as Francisco says, it's an amazing opportunity for us to see this money coming out here. So if we don't push, we're going to be left behind. So.
And I'm going to add to what you just said. One of the things that I think in a little bit, even in our meeting, it's kind of hard to dream real big when it comes to grant work because you put a lot of work and you might not get something in return. And so one of the things that, especially jurisdictionally, and I know that Deva's not here, but I'll talk to him as well. If we can kind of push some of our jurisdiction a little bit to just walk this out and dream big, because it's real easy just to do a little bit more of what we do now and ask someone to help pay for it. But this grant is not that. This grant is bigger than that. And so hopefully we can see it, because someone's going to get this money, and why not us? And so we could really see something that could really make a difference.
Yeah, I think if we look at this too from the standpoint of how we've been rated in the past by EPA and Lung Association, people need to understand that and get excited about this. So we've got an opportunity here now that can help change how they've looked at us in the past.
That's awesome. I just also want to do a comment and just do a plug for your team. Thank you for how you are working with our businesses. This isn't the first time you've done this, but with the mining group, I know that sometimes it's wrestling certain situations and having a lot of conversations and things, but I appreciate greatly. I think you represent the board very well in how you've handled that. And so your team, please give them big kudos.
Will do. Thank you.
Thank you. Okay.
Let us know how we can help.
Will do. Thanks.
Thanks.
Moving on to Community and Clinical Health Services, and Lisa Litritz.
Again, Lisa Lotters, Division Director for CCHS. You have my report. I have nothing to add today, so I'm happy to answer any questions you might have.
I'm sorry. Say it one more time. She distracted me.
I have nothing to add, but happy to answer any questions for my report.
Gotcha. Any other questions, thoughts, concerns? I don't see any.
Okay,
Thank you so much for the
thank you.
information. Appreciate you putting it together. Moving on to Environmental Health Services, Program Activities, Robert Fida.
Afternoon, Board. I don't have too much to add. I was going to say I think my staff did a great job in highlighting some of the innovative work that we do in environmental health. So I just wanted to highlight just a few quick things so that the Board is aware. In your packet, you'll find that the September larvicide treatment that we had scheduled was canceled, and that was due to lower temperatures in the area and reduced activity of the mosquitoes. And then the other one I wanted to highlight was that our food safety plan review team has conducted some training for mobile food truck classes, specifically regarding fire hazards. So, and that's kind of all I wanted to highlight. So,
Any thoughts, questions?
Where's the drone?
I was going to say, I believe we just sent the letter to the FAA and we're awaiting response.
Yes. The revised letter that we discussed did go to council and the person who is the application contact at the FAA. I let them know if they had any questions regarding the revisions and the designation of board, please get in touch and let me know. I haven't heard back, so I'm optimistic that the letter and the application is now proceeding as it should, and I'll stay in the loop on that as well.
Thank you for your help with that. Thank you. Thank you for the update.
Thank you.
Okay. Moving on to epidemiology and public health preparedness with Dr. Nancy Dow.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So you have my report, nothing to change or add here, but just one quick highlight with the flu season officially started the first of this month. So our weekly reports are posted online now, as well as are sent out weekly on our listserv. Currently, influenza-like illness activities are still low and below Region 9 and Nevada baselines. Hospitalizations are still very low, and from the small subtyping that we had, our dominant strain is flu A, H1N1. This is similarly reflected nationally in terms of the dominant strain seen right now, too. So do note that this year's quadrivalent flu vaccines composition did have the H1N1 updated, so which hopefully we'll see a good match this season. RSV also remains low right now. We're seeing slight increases week to week for the past 3 weeks, but nothing out of the norm right now. Cases are lower compared to the 21 to 22 and 22 to 23 seasons at the same time, and are comparable to the 2019 to 2020 season around the same time. So that's all my updates. I'm happy to answer any questions.
Thank you. Any questions? Hearing none. Thank you so much.
Awesome. Thank you.
Thank you for always smiling. Mr. Kevin Dick.
Yes, thank you, Chair Dare. Well, first of all, I just wanted to say I'm grateful for the kind comments that people provided on my performance evaluation. And thank you to the board for the 5% merit and for taking it easy on me for my last evaluation. So thank you very much. Want to provide a few updates on my report. I had that I was presenting at the Reno City Council would have been yesterday, but that item did not get on their agenda, so I am told that it will be on the agenda for November 15th, so I'll provide my update on the Northern Nevada Public Health name change at that point. Very proud that Joelle Gutman-Dodson was appointed by Secretary of State to the Task Force on Safe Sidewalk Vending. She's the only Northern Nevada representative in that task force, and she's the representative on the task force representing public health. So they had their initial meeting yesterday, so that's now underway. And just wanted to also highlight for some of our community health improvement plan activities, Family Health Festival that was held on October 5th at O'Brien Middle School. That we had about 320 community members that participated in, and the first Golden Pantry, which is a grocery pantry set up for seniors, and we had a soft rollout with that event with about 30 people that participated, so off to a good start there. Our CCHS assessment of clinical operations is underway. There's been an initial meeting that's occurred. I believe the third party that we have conducting that is 330 Partners, and we're impressed with the the thoroughness that they're approaching this with. And so we're now actively engaged in compiling all of the information and data that they wanted us to submit to them for evaluation. So that's moving. And lastly, I just wanted to remind the board of our retreat that's coming up in November. So it's Thursday, November 9th. This is a meeting that we're having in the morning. So, and we currently have it scheduled in conference rooms A and B off the lobby. So we are hopeful that our lobby remodel will be completed and that room will be available for the retreat. We do have a backup plan. If that's not the case, then we'll meet here in chambers. But hopefully we can utilize conference rooms A and B over at the Health District. The plan is to have some coffee and breakfast snacks and whatnot available about 8 o'clock. And we'll get going formally with the board retreat at 8:30 and wrap up by about noon. So that's all I've got.
Am I correct? 'Cause I think I got in trouble one year for wearing a tie.
Oh, yes. Yeah, thanks for reminding everybody.
Yeah.
Yeah, this is, we're taking a more casual approach for the retreat.
So that's important. And then I do want to commend, and I just want to all the staff out in the community. I have seen our ambassadors out doing a great job at things that I didn't know, really more than I've ever seen out there. So they're doing a fantastic job representing health and making sure that it's accessible for anybody interested. So they did a really good job.
I was in the Buffalo airport on a Saturday afternoon, and I received a text from our chairman, him taking pictures of our people out and about.
Yeah, it's true. Yep. Well, very good. Any questions, concerns, thoughts? Very good. Is there, moving on to 19 then, well, I do want to say one more thing before we go to that. I do want to say there's not tons of more comments to make because we already did, but I do think that it's very deserving of the increase, and I think you have worked well, and we look forward to this next season for you, and thank you for sticking around to do it right and being committed to the process, so appreciate that. Now going on to board comments. Any member want to say anything, share anything?
I do have a comment.
Sure.
Is this on? Hello?
You're on.
Can you hear me? Okay, perfect. I just wanted to give a little bit of a shout out. It is Breast Cancer Awareness Month, and I wanted to just give a shout out to really everybody, anyone who's struggling with breast cancer. We stand with you on that and are here for you for resources and anything that we can do. I'd love to highlight just a couple things that 1 in 8 women will be diagnosed with breast cancer in her lifetime. An estimated almost 300,000, 297,000 women, and about 2,800 men will be diagnosed with breast cancer just in 2023. So it is a very common disease, and we want to be aware that mammography is the best way for screening and for patients to receive mammograms. We have them all over the town. In fact, most of the places in town, including Reno Diagnostic Center and St. Mary's, I know for sure, do not even require an order. So as long as you do not have high risk factors, which puts your screening oftentimes younger than 40, then the recommendation without those risk factors is to start at the age of 40. And most places you can just walk in to get mammogram screening, including at St. Mary's at multiple locations. So we stand with you, and we just want that awareness out there to get screened. It's the best way for us to get that information out there. Thank you.
She did a very good job of the same presentation on Channel 8 yesterday at lunchtime.
Oh, thank you. Thank you.
Very good. I do want to invite anybody on Veterans Day that are looking for something that is totally free for your family at the Nevada Veterans Memorial. You can bring your family out, and there'll be, I believe, crumble cookies and milk as well, so you can bribe your kids that way, but you could have an experience there, and it's free. A lot of times you're looking for something local, and I think it's good for the heart of our community. So with that said, I believe we are moving to adjourn. Very good. Have a great day.